A veteran emergency room nurse we will call Clara is so worried about her profession that what she's about to say could get her fired. Many months into the COVID-19 pandemic, Clara says hospitals are so short-staffed that patients are dying in the emergency room who might otherwise be saved, including one of her female patients.
Ultimately, by the time someone was able to get to her, she was at a point of disrepair. That's the best way I can describe that. We weren't able to fix her. And ultimately she died. That's hard to carry.
Family members are sent to hospital parking lots for lack of space as the sick wait most of the day to be seen.
People are literally shoulder to shoulder. You could be sitting next to someone that is COVID positive and you're not. It could be 6, 8, 10, 12, 16 hours before you get that care that you need to get better.
You heard right. She said up to 16 hours before any treatment.
It definitely is a crisis.
Abigail Donley left the hospital ICU earlier this year to create the advocacy group Impact in Healthcare to fight for policy change. She spoke on Skype.
Nursing ratios are terrible. The workload has become unbearable. Nurses are getting hit. They're being verbally abused.
The American Nurses Foundation says COVID is causing 9 out of 10 nurses to consider leaving their hospital jobs. Half say that inadequate staffing is the main reason. So where are they going?
Travel nurse.
Travel nursing.
Travel nurses.
Travel nursing.
Michelle doesn't want us to give her real name because she's in the minority of nurses who are unvaccinated. She left her hospital when a COVID vaccine mandate was introduced. An agency hired her as a travel nurse to fly wherever she is needed for short contracts.
I'll literally be making in 1 week what it takes me a month to earn.
Nurse Jonny Sorber loves his New Jersey job and his colleagues. The nurse in the middle left for a travel nurse job in Alaska that pays $10,000 a week.
It's just absurd.
Yet tempting for Sorber and his young family. Sorber says hospitals need to find a way to retain and lessen the stress on veteran nurses.
I think just higher pay. At least something. Like higher pay, and there's always a shortage of nurses. If you could get the right amount of nurses so you don't actually have to work harder.
We asked the American Hospital Association about that idea, higher pay and more nurses. They had no official comment, but sent VOA a document asking Congress and the Biden administration to intervene, to, quote, use its authority to investigate anti-competitive pricing, unquote, from agencies hiring travel nurses. But for now, some hospital nurses are at the point of complete exhaustion, with compassion fatigue, a lowered ability to empathize. They were thrown into a pandemic war beyond their control and are still fighting, with ever fewer staff.
So just try to be kind. We want to do what's best for you, and where we're at right now in healthcare is really scary.
For nurses and their patients. Carolyn Pursuti, VOA News.